And Kathy, I'll hand it over to you.
Great. Thanks for coming and attending this afternoon. My name is Kathy Walker. I am the facilitator for this QPR, Gatekeeper Training. I've been certified for several years now and have conducted the course on several occasions. I do have a video that I wanted to share real quick that kind of introduces this. It's a good setting for this. So we'll see if technology will cooperate.
It may be hard to imagine, but according to the World Health Organization, over 800,000 people die each year by suicide. That is more people than are killed in all the wars and homicides combined. Of these deaths each year, more than 40,000 are Americans. That is one death by suicide every 13 minutes. Suicide affects every region of the world and is the third highest cause of death for people aged 15 to 44. And for every life lost, another 25 people will attempt suicide, often causing serious medical injury or lifelong disability. Today, the greatest loss of life is among working-aged men, 35 to 65 years old. Men of all races and ethnicities are at higher risk. And from the very young to the very old, millions of Americans think seriously about suicide for days, weeks, and even years. Thinking seriously about suicide is itself a kind of misery index, a sign that something is terribly wrong and needs attention. Most often, what needs attention and treatment is clinical depression, a medical condition that is now the leading cause of disability in the world. In America alone, there are an estimated 15 million sufferers. Most of us are touched by suicide. Some of us have lost family members, loved ones, friends, schoolmates, or colleagues. None of us escapes the loss of people we admire and respect, whether they are people we know or are much-loved musicians, artists, and entertainers. If you have lost someone close to you to suicide, then you already know the considerable cost, the tears and awful pain of loss. And if you are one of the millions who have thought seriously about suicide, then you already know just how lonely and terrible it is to suffer alone. Depression, anxiety, substance abuse, bipolar, and thought disorders like schizophrenia all contribute great risk for suicidality. Yet most people suffering from a mental illness do not kill themselves. They get help, they find a way, and they recover to live full and productive lives. And if recovery is possible, that means suicide is preventable. Thankfully, the world is changing. We understand mental illness. We understand suicide. And we know that treatment saves lives. Right now, our teachers don't teach us about depression and suicide. And our faith leaders often struggle to talk openly about these topics. Too often, doctors can't talk to their patients about suicide. Even patients who are sitting in their offices planning how to end their lives, perhaps by overdosing on the medication being prescribed to them. The world remains dangerously ignorant about suicide. So to save lives, we must bring the subject out of the shadows. Effective treatment would save thousands of lives around the world. But we must learn to talk comfortably about suicide, and we need your help to start the conversation. Join us in this fight, a fight to save lives. Preventing suicide, it's what people do.
Okay, so that video just does talk about suicide, suicidality, and really what the realities of it. It is something that does happen more than we like to think about and talk about. And part of what QPR, Question, Persuade, Refer is to help us become more comfortable with the topic and to know more about it. So QPR is not intended to be counseling or treatment. I am not a trained professional other than how to teach this. So it is important to keep that in mind. It's intended to offer an array of hope, some kind of positive action to help someone that's in a crisis state. So we had some myths about suicide. Some of these have been around for a long time. That no one can stop it. It is inevitable, and that is not true. People in crisis that are thinking about suicide um, oftentimes just need to be heard and understood, and they may never be there again. It's important that we recognize that it is a preventable situation. Confronting a person about suicide will only make them angry and increase the risk of suicide. A lot of people have heard this and feel this, but actually the counter to that is true. If you confront someone or ask someone, I shouldn't say confront, if you ask someone respectfully, but directly about their suicidal intent, it actually lowers their anxiety and they feel more open to communicate what's going on, and that reduces the risk of an impulsive act that may be regretted later. So just know that it really, talking about it doesn't like plant the seed or the idea. It opens up channels of communication. And that only experts can prevent suicide. No, anybody can. And that's part of what QPR is all about, is just being there and available to your fellow human that may not be in the best of places psychologically and mentally. So some additional myths and facts. Come on. That people keep their plans to themselves. Sometimes, but sometimes not. When people are communicating their intent, it's usually weeks preceding their attempt, and it's usually a cry for kind of an indication that something's going on, and that would be a good time to intervene and to have a conversation and start asking some questions. And we'll get into what kind of things to look for with people, okay? So people who talk about it don't do it, not necessarily, but they may attempt some type of self-destruction, self-harm, cutting, those kinds of things. So those are outward signs that could be occurring that are concerning. Once a person decides to attempt suicide, there's nothing anyone can do to stop them. Again, it is a preventable situation. We just need to be a positive action, be a person that cares and shows something to be hopeful for, and helps them out. So important. So there's some clues and warning signs that we can observe, and when we see these in someone, that shows signs of risk, so we want to take them all seriously. Direct verbal clues. So basically somebody just says, yeah, any of these statements here on the screen, or something to that effect, where it's very direct, it's very clear what they're thinking. Sometimes people will do that. So that's one way of a clue, is that it's very direct and it's verbal. Sometimes there's indirect verbal clues that kind of beat around the bush, but you can tell that there's something they're down, something's bothering, I just want out, I feel trapped. Those kinds of feelings are concerning. And so we want to have further discussion with somebody when they're starting to talk about like this. Before I move on to behavioral clues, any comments or questions on the verbal indirect and verbal direct? Okay, behavioral clues. So we can see some clues in people based on their behaviors. So if they have a history of previous suicide attempts, this definitely something just to be, or suicidal ideation too, something to be aware of. An attempt is far different than ideation, clearly, I think. So acquiring a gun or stockpiling pills. Guns are the number one way that people die by suicide. So I don't have a gun in my home. I probably never will, for a variety of reasons. But stockpiling pills is another way they're developing a plan. Co-occurring depression, moodiness, hopelessness, those kinds of behaviors and issues always kind of increase risk for suicidality. And then putting personal affairs in order sometimes can be a clue as well, especially if it's just kind of coming out of the blue. More clues as far as behaviors is giving away prized possessions, a sudden interest or disinterest in religion, and drug, alcohol abuse or relapse, and then unexplained anger, aggression, and irritability. So definitely the unexplained anger, aggression, and irritability can oftentimes come with along with someone that's struggling with anxiety and depression. Those are often co-exhibited. So just be aware. Sudden interest or disinterest in religion is interesting, but it's definitely a clear change in behavior that can be a clue for sure. Situational clues. So situations that kind of can exacerbate, and make someone not want to live any longer. Being fired or expelled from school can seem catastrophic. An unwanted move. Moving is stressful, moving is difficult, and if it's unwanted, that can make it an even bigger stressor. Loss of any major relationship can often be a tipping point for someone. Death of a spouse, a child, or a best friend, especially if it's by suicide. I have a friend that lost her son to suicide, and Mother's Day can be very difficult for those individuals. So did reach out to her and shared my love for her. Situational clues, a diagnosis of a serious or terminal illness in the family or the individual, and they don't want to be a burden to someone, so they may, have those suicidal thoughts. Unexpected loss of freedom or fear of punishment. Financial security, loss of financial security, that can be a real big one for a lot of people. And loss of a therapist, a counselor, or some kind of confidant. These situations can potentially be a risk factor for suicidal thoughts. And I already mentioned becoming a burden to others. They don't want that. So tips for asking the suicide question. I'm always I kind of like to be pretty much direct and to the point. So I would just ask, are you thinking about suicide? And ask it in a compassionate and caring manner. If you don't, if you're in doubt, don't wait, but ask the question, because timing is important. And if if the person seems reluctant to answer, you want to kind of say, it's okay. You can talk to me. Let me know what's going on. I'm here for you. But always do this in a private setting. You want to be respectful of the person. You want to allow that person to freely talk and express themselves. You don't want to put, words in their mouth. Definitely want to be compassionate and non-judgmental, but actively listen and care. And just give yourself plenty of time to hear this person and to share with them. Two, with QPR, there is and I mentioned this, there is a little booklet that people can receive that get QPR training. If you are interested in getting that booklet and a certification for attending this training, please do email me, and we can discuss how to get that to you. And my email is kwalker@indianarha.org. A less direct approach to asking the suicide question is, these are okay, but just being unhappy, and things like that, just kind of, again, going around the bush a little bit about it. But don't be afraid to use the word suicide. There's going to continue to be stigma around suicide, that word, until we start using it more. And I think we are making a lot of progress in that area. But I'd encourage you to get familiar and comfortable asking about it. Even just practice with a friend or someone, but use the word. So anyway, you can be direct, you can be indirect, but just ask if you feel there's suspect or something might be going on. So here's a direct approach. I like this first one is, when people are as upset as you seem to be, they sometimes wish they were dead. I'm wondering if you're feeling that way too. We're not using the word suicide, but it's the act. We're still saying it, but it shows compassion. It shows openness. It doesn't show judgment. So I think that's really, really important. However, you don't want to ask these kinds of questions. The first thing that comes to mind when I read one of these questions is judgment. There is not understanding or compassion. It's very judgmental in condemning. So we don't ever want to ask these kind of questions of someone that we think might be having some suicidal ideation. So that's question and the Q part of QPR. So then we're going to talk about persuade, P. So how do you persuade someone that is thinking about ending their life to not? First of all, we've asked if, confirmed that they are suicidal. And so now we want to ask them if they will get help and how we can help them to get help. So again, so we want to persuade them to seek help or to receive help. Okay. So again, it's so important. Listen to the problem, give them your full attention. Remember, suicide is not the problem. It's only their perceived solution to what they perceive as an insolvable problem. So it's keeping that in mind is helpful. Don't judge and offer any kind of hope in any form. Okay. So this is how we're going to persuade them. Then we're going to ask them, will you go with me to get help? Will you let me help you get help? And will you promise not to kill yourself and, until we can get you some help? Just hold on there. We can help. We can get through this. Okay. They need to hear that your willingness to listen and to help them. Because they don't want to feel so alone with it. They feel very alone with it. Okay. So it's very important to be there for someone and be willing to help them. I would also suggest that you familiarize yourself with the mental health, behavioral health resources in your area, so you know where you can take someone or who you can contact if you're in this situation and need to take someone or to connect someone with help. And always ask permission. Can I help you? Will you let me take you? Can I make a phone call with you or for you to get you some help and talk to someone that's better, trained in these areas? So then refer. That's when, okay, we've asked questions, we've confirmed yes, we've persuaded them to get help, and now we need to make that connection. A lot of times, people that are suicidal and have struggled with depression for some time really don't believe they can get help. They really have no hope. They've maybe been through a number of things and just not been able to get through some situations. So understand that as well. The best referral, if you can, or you're in a situation where you can, and someone is contemplating suicide, if they will allow you to, it's best if you can go with the person to help, to a behavioral health, mental health facility, to the emergency room, to a therapist, whoever. Getting a commitment from them to accept help would be next. And then giving them the referral information and trying to get a good faith commitment that they're going to act on it. I have taken people to a mental health hospital that were suicidal. So it's quite an ordeal, but it's good to have someone there with you if you need to do that. Remember that almost all the efforts to persuade someone to live instead of taking their lives are usually met with an agreement and relief. Someone gets me, someone cares about me, and it can make a difference. It literally can save someone's life. So please don't underestimate just how much caring and listening can do. So you want to express, that you care, you want to be with them, you want to get other people involved, help build a support system around this individual. And that's going to be supportive and understanding. Okay. Also, if there's ways that you have an interest in suicide prevention and mental health, there's groups you can get involved with. In your community. Generally, there's a number of support groups. So again, when you have this experience with someone, make sure that it doesn't stop there. So say they've got help, they're doing better, but you need to still keep checking in on them. So make a phone call, make a visit, send a card. Just continue to be there. It's not just the one time. Be there as a source of support on an ongoing basis. And so what we do with QPR, with these steps, it's like CPR, but this is QPR, is we're planting seeds of hope by showing our care and concern for another human being. We're getting them resources and we're giving them a bit of hope. And so that can help prevent suicide in and of itself. Following up with the individual can help to grow those seeds, if you will. So I'm going to skip this one. Okay. Anything else? Any questions come in at all?
So, the second step is persuade. And then you get to the refer where you've got some sort of action items.
Right.
What if you come up against somebody who's like, I'm not suicidal, I'm not ready, or maybe is, admits that they're struggling but does not want to seek help? Like, is there a cycle back? How do you move if you get resistance in the second stage?
Yeah, that's a great question, and common. And that's why, if you're seeing lots of risk factors based on some of those signs that we've talked about, and they have admittedly said, yeah, I'm having a hard time, I'm not in a good place. Just keep talking, try to be consistent, persistent rather. And if you can somehow relate to them, sometimes if you're pretty confident that they're in that place, I wouldn't leave them alone for a while. I would continue to try to speak with them. I would get other people involved, so people are kind of keeping an eye, maybe reaching out a little bit. Sometimes a dark state like that does pass, but yeah, I would just build the support and continue to be the support and just continue to, I wouldn't hound them because you could make them mad and that kind of thing. But yeah, just continue to be there as best you can. Provide resources. Sometimes, especially with some of our men, because men don't tend to talk about these things as openly. Sometimes we might need to be a little more discreet about like leaving resources in a place where they see it and others don't. Those kinds of things where we just keep the topic available as well, if that makes sense. Does that help?
Sure.
Anything
Okay.
else?
Any other questions? And again, this would be the time when if you have a question you'd like to ask verbally, you can use the raise hand function and we can unmute your line. Or if you have a question you'd like to put into the chat or Q&A, we would like to have that. In the meantime, I will launch our second poll here before we end today's session. Just a quick follow-up. Hopefully everybody can see that now. And we'll give it just another minute or two for questions to come in. Kathy, thank you so much for the information you've shared today.
My pleasure.
I think it can be very difficult to take this step. It can be uncomfortable. It can be scary, but if somebody's truly in crisis, what a blessing to be able to be prepared as the person on the other end to help them a little better.
I did just put my email address in the chat again. If you do want the QPR booklet and certification, please contact me by email. Thank you for having me. Thank you for coming. Attending this is another way to help reduce the stigma, is that you're here and you're participating and you're learning. Just take it out and talk with others about it. Thank you.
Okay. Well, thank you all for your time today. Again, we'll have this up to our YouTube channel in about a week and a half. Again, Kathy's email is in the chat now. And we hope you all have a wonderful day.